Well, thank you so much. It is so nice to be kind of in front of an audience again, everybody. This is great. And we've got a lot to do this hour. First things first, we want to welcome you to the 2022 Guide to Medicare, hosted by the Buffalo News. Again, I'm your host, Linda Pellegrino. And I got to tell you, as a retired host of AM Buffalo and current host of senior radio on WBEN, Medicare is a topic I know a lot about now. I certainly didn't when I started out. It's if it's news to you, and let me tell you, it's news to a lot of people. This subject can feel very intimidating and overly complex because it is. And that's why we are here tonight to demystify the process and try to answer as many questions as we possibly can. We're going to show you how we're going to do that in a few minutes. We're going to use a chat where a lot of popular questions will be popping up on your screen. But also, folks, you can actually go down to where you see chat at the bottom of your screen. And when you press that, you can enter your question, and hopefully we'll have one of our experts answer that today. Now, speaking of experts, our expert panelists have decades of experience in the worlds of medicine and insurance benefits, and they are here tonight to provide independent, expert, and unbiased advice on the topic of Medicare and supplemental plans. Their goal tonight is to ensure your questions are answered and that you leave tonight's webinar with a better understanding of really how it all works and with the framework to help guide you to make the best decision for your own coverage. Everybody is different. So with that, let me introduce our expert panelists. First, you're going to meet Bill Daniels. He has worked for the Erie County Department of Social Services for more than 35 years as a coordinator of insurance, outreach, and counseling. Bill is an expert on all things Medicare. He gets a lot of questions, and he'll provide unbiased advice regarding filling those gaps and paying for long-term care. He understands the ins and the outs of Medicare Advantage plans and the standard Medicare supplemental plans available in Erie County. And I've had the pleasure of having Bill on the radio with me. So, Bill, it's nice to see your face here tonight.
I know that.
Great to have you here. Next, we have Larry Acker is with us. He's a New York State licensed insurance representative who has worked for 36 years with Medicare supplemental and Medicare Advantage products. He is the founder of Health Resources Insurance Services, and that's an agency that provides products to more than 50 brokers across the state. And his agency has received numerous awards for excellence in sales, service, and long-term customer retention. He also comes to the table with the view of all plans available. And last but not least, we have our third panelist with us tonight. We have Michelle Grecian. Now, Michelle has been employed by Univera Healthcare for over 10 years now, most recently as the regional Medicare sales consultant. She also has a degree in nursing education. She received a full ride to Florida State University to play softball. I love that. Michelle is an avid community volunteer. She has donated her time to several community organizations, including Hearts for the Homeless and Hospice for nearly 20 years. Michelle, it's great to have you involved in this tonight. This is great.
Thanks for having me.
And we want to thank Bill, Larry, and Michelle for joining all of us who are watching tonight. And of course, we have to also thank our sponsor, Univera Healthcare, for bringing these panelists to our living room this evening. So before we begin, I'd like to give you kind of a brief overview of how we're going to structure this hour and how you at home can participate. So first, we're going to go through a general interview or overview topics. What is Medicare? What is the supplemental? What is the Advantage plans? So we're going to do that throughout the panel discussion. So if you have questions as they pop up, we invite you again to type in your question in that chat section that you see at the bottom of your screen. And we're going to try to get to a lot of them, if not all of them tonight, okay? Now, we have a lot of ground to cover. So even if you're just joining us now, we want to let you know we're really thrilled that this is being recorded. And if you have signed up for this webinar, but you're just joining us a few minutes late, well, guess what? You'll be able to get this entire broadcast in its entirety. So you can go back and listen to the parts you may have missed, okay? So we're going to get going today. We're going to move to our first topic of the hour. Bill, we're going to start with you and the basics. So tell us, what are the different components of Medicare and how do they work together to provide coverage?
Okay, there's basically three components of Medicare. Part A, which is for hospital care. Part B is for skilled care. And Part D is for prescription drugs, usually the ones that you get at the pharmacy. So the main thing is to keep in mind your eligibility for Medicare as well. It's usually age 65, or unless you're disabled, in which case you can get it much younger. I've dealt with people in their 30s that are on Medicare because they're disabled. So it's important. It's been around since Lyndon Baines Johnson's Great Society. So it's a very well run program, very well established, low administrative costs to it. But the thing is you're going to look out for is your out-of-pocket costs, because Medicare doesn't cover everything.
Right.
For example, under Medicare Part A, there's a $1,556 deductible, and that's usually for the first day of hospitalization. If you're in the hospital from day 61 to 90, it costs you 385 hours per day. If you're there 91 and beyond, it's $773 per day. So that can be a major expense, and that an incident of illness, which usually lasts for while you're in the hospital and nursing home under Medicare. But once it ends, and if you have multiple hospitalizations during the year, it can be very expensive for you.
Okay.
Medicare Part B has a $233 deductible per year. That's an annual, and 20% co-insurance.
All right.
Part D could have up to a $480 deductible, and copay, generally speaking, 25%. So you want to try to find a way, especially on a Part A and Part B, to fill those gaps of Medicare. Under original Medicare, there's no cap to your out-of-pocket expense. So people are looking to a supplemental policy or Medicare Advantage, who I think Larry's going to talk next about supplemental.
Right, because there are those gaps. So Larry, let's move on over to you. How do Medicare supplement plans then differ from the Medicare Advantage that we hear about?
There's many different aspects that are different with Medicare supplement. Probably the biggest one is, as Bill was explaining, is the Part A hospital coinsurances. Medicare supplement will cover all of those Part A costs. Well, let's say 99% of the Medicare supplements will cover all of the in-hospital copays and eliminate any out-of-pocket for hospital room and board, which is the big expense that generally hurts people financially. The other, and as well as even with the medical, most Medicare Advantages are going to have co-insurances and copay structures for pretty much any type of care that you receive, whereas Medicare supplements are generally going to be limited to either a small minimum copay, or in some cases, no copay after the person reaches their deductible, which for Part B would be $233. That would be as far as the benefits are concerned. Medicare supplement generally has the majority of people that we recommend Medicare supplements to. There's two reasons. They've advanced it up to a particular point in their age where the amount of care that they're receiving each year has become, excessive, or let's say they're doctoring on a very regular basis. And sometimes in that particular case, depending on the care that they're receiving, a Medicare supplement that doesn't have those copays and co-insurances is going to be better for them. Obviously, Medicare supplement comes with an additional cost, where the average price on a Medicare Advantage runs from anywhere from $0, or even in some cases cash back to your Part B, maybe up to as much as $100 a month. With a Medicare supplement, you're going to average around somewhere between $150 to $200 a month for the Medicare supplement, and then you have to carry your Part B standalone, which would run about another $50. So in relationship, you're from 0 to 100 on a Medicare Advantage as far as your out-of-pocket premium. With a Medicare supplement, you're going to be somewhere between $185 to $250 a month. So there's a huge difference in cost to the senior. So from a cost standpoint, or let's say people just reaching 65 years old who are not using a ton of medical care, maybe going to the doctor once or twice a year, not really doctoring for anything significant, often we'll steer those younger, healthier people towards a Medicare Advantage program. And then, of course, I've got customers, some of which that I've had for 20 years, and they do get to the point where the type of care that they're receiving it makes more sense to go with a Medicare supplement.
Okay.
The other big issue is Medicare supplements are private fee-for-service programs, which means they have no network. Okay, so the most of your Medicare Advantages and most in our area, depending on the carrier, are all pretty much either PPO or HMOs, which means they're going to have a network. They're going to have a diagnostic related group that does get involved in determining the type of care that you receive. With the Medicare supplement policy, they don't have that. So literally, if they wanted to go to Arizona to get their knee replacement, they could do, there was a particular doctor there that they wanted to go see. My father, as an example, did that. That's why it's coming to mind. He liked the position that was available in Arizona, and he did his surgery in Arizona, and he did his rehab in California.
Right.
So
Let me
that type
stop
of
you
thing.
there, Larry, because Michelle, I'm going to come to you because as we can see just from what Larry and Bill says, you don't want to go into this alone because you're going to do yourself a disservice because there's just so much information. So let's say I'm getting ready to turn 65 with my husband, Michelle. We both come and see you at Univera. We may end up with two different plans, right?
Yeah, absolutely. You kind of, you just sit down and you kind of just talk, and you let them talk and you listen, right? And you kind of like just listen to their current situation that's going on, their health situation, and then you kind of make that, that comparison and that determination whether, they need a supplement plan or they can, use a Medicare Advantage plan. So absolutely, you could be walking out with one plan and your husband would be walking out with another, possibly. And it's never a joint plan. It's always, one plan for you and one plan for your husband as well.
And it has to do with what these plans cost, what these plans include. Is gym membership important to you? Things like that, which some plans will include. And certainly you can compare plans for people. So if let's say we have one spouse that's on a lot of medications, you can do a plan that is going to work for that person and cost them less, and make sure that they're entirely covered with everything they might need.
Absolutely. I mean, so, Part D coverage is very important, right? Obviously, you got to have it because if you don't, you can get penalized down the road if you don't have it and if you pick it up later in the future. So, yeah, exactly. A supplement plan, those are the ones that do not have prescription drug costs with them. So you would have to either go through a private insurance company for that, or you can actually go to Medicare.gov. You type in your prescription drug coverage, and some will pop up based off of the good plans will pop up based off of the prescriptions that you put in. Also too, with a Medicare Advantage plan, that's kind of like an umbrella.
Mm-hmm.
It has everything. It has Part A, it has Part B, and it has Part D for drugs, right? So that is the most convenient one, that everybody does affordable. That's where your gym membership is, your vision, right? That over-the-counter benefit that you have, all that, good stuff. The preventative dental, which, it's what everyone's looking for these days.
So, Michelle, the soonest you can enroll is 3 months before your 65th birthday. You get the 3 months before and after your birthday to make your plan selection, okay? And I understand you need to call Social Security to get your red, white, and blue card. And most enrollment periods are through June 31st to accommodate other things. So, what I guess I want to know, and Larry, will go to you, or Bill, let me ask you, what if you're approaching 65 then and you do some research on Medicare, you start thinking about enrollment and things like that, but what's the first step then in getting signed up for Medicare?
Like you mentioned, you apply through the Social Security Administration.
Mhm.
And then you decide if you need Part B or Part D. Like I mentioned before, I'm 70 years of age. My wife is 68. We're both covered under my active employment. I only have Part A
Mhm.
because my benefits through the county, which I pay towards each month, are better than I get on the open market. So you want to first, the medicine is a major thing to look into. You
Mhm.
find great variance between the meds, between different plans. Also, it's important to check the pharmacy. Some pharmacies are standard, some are preferred, and some might be out of network. So usually when they call us and Sue in my office and I, mainly Sue, we put together a comparison sheet
Mm.
between all the Medicare Advantage plans that are available to individuals. We also have all the Medicare supplemental policies that are available to individuals. There's paid for by your tax dollars, and they just call us at 858-7883. We'd be happy to send it out to you. And it goes through there. Part B is optional, and if you're a veteran, some veterans don't get it. Depends upon your status with Veterans Administration. I always advise people to make sure they're well covered,
Mhm.
especially for prescriptions, because that appears to be the great variance between the plans. So that and drugstores are two big things you want to look into. Again, we do comparisons here.
Right.
858-7883. We're more than happy to send it to you. It's taxpayer supported.
Now, Bill, you're in
Yes.
Erie County, but Larry, I know you're working in Niagara County, and that's important for some of the viewers who are watching.
Yeah, we're located at 664 Niagara Falls Boulevard, but we serve all of Western New York. As you mentioned, we have 50 representatives, so we pretty much cover all the counties, depending on the person's need. But I did want to add one thing to Bill's response. Okay, Bill's situation. He is still working past 65 years old. You have to work at least 25 hours a week to make the election that Bill made. Most people, not all people, but most people don't have that option, unless, of course, they're working full time after 65. And again, you got to be careful with that, because we have seen people decline Part B of Medicare just because they didn't want to pay the $170 a month and not understand that causes very big problems for them. So there is a very limited specific situation where you would decline Part B. Those two situations are either Bill's situation, where he's working at least 25 hours a week past the age of 65 and is also fully covered and most likely fully paid for through the county. Most people, when they turn 65 years old, do need to look at that, though, because a lot of people that are just turning 65, even if they're still working, they still have to contribute to their health care cost.
Right.
Often, a lot of groups will cover, for example, the retiree, but then won't pay for the spouse. And as Michelle had said earlier, often we do have people come in and we're recommending one thing for the husband and then something different for the wife. As far as and then yes, of course, you get to the comparison of the programs, but the first thing you need to determine is whether or not you are going to be going on Medicare or not going on Medicare. And that can be a complicated question that would be difficult for me to explain all the aspects of that. And that's one of the reasons we talk to people, whether they come into our office, they call us on the phone, we do Zoom appointments like this meeting here. Most seniors are still, as you guys had mentioned earlier, we were talking about earlier, they do like that non-computer situation. It depends on the individual. Some of the people turning 65 right now are changing. Obviously, they're more familiar with using some of the technology, but it is a fairly comprehensive review that someone would need to do when they're reaching the age of 65. Getting information like Bill had mentioned on all the different programs and all the different options is also very, very important. Or literally stopping in and speaking with somebody like Bill, when you're 3 months out from getting a Medicare, that is the time that you definitely want to sit down with somebody to just help you go through
Right.
all the different situations that are available. And there is a lot of resources available now for that kind of information.
Okay, now let me also stop, because from what I have learned in just the past few years, we have such great professionals here in Buffalo to talk to you about Medicare, and they are here 365 days a year. If I can get everybody to not call Joe Namath or, you know, or JJ Walker, because you see this 800 number, I would be doing my job tonight. Believe me, there's nothing in those ads that you're not going to get by talking to these professionals that we have here. They'll learn who you are. They'll be there for questions all year round. You won't be getting a different person on the phone who doesn't know you trying to make a decision. And they'll make sure you have everything that you need to stay healthy here in Western New York. Michelle, let's go back to you again, because we went over that Medicare is comprised of parts A, B, C, and D. Can you just go over real quick what each of those is?
A, B, C, and D. Yeah, that's, you know, pretty much what Bill had mentioned when we first started, right? You always have your, you know, you have your part A, which is, you know, your hospitalization, your part B, which is your medical, and then part D is your prescription drug coverage, right? And then part C, which is also known as a Medicare Advantage plan, that's the umbrella that has all of the coverage underneath it, you know. So those are the parts, and everybody kind of gets confused about it, you know. Right. It's very confusing. They don't know, you know, if part A is automatic, or if they have to apply for it, if they have to apply for their part B, you know. And then of course that penalty, you always got to be careful that you pick up that part D, you know, as soon as you start going, so that you're not penalized in the future.
So I also want to ask that if you go in and talk to you or Larry or Bill 3 months before or after your 65th birthday, and it's not an enrollment period, when would somebody be enrolled?
Well, you know, we do have a lot of different election periods, right? I think, you know, when we talk about things, we always hear like AEP and OEP and SEP, and, you know, everybody's like, you know, what is so confused by all those acronyms, right? All those, right? So when we do an overview, IEP is that initial election period, which is that 7-month window, right? There's that 3 months before your 65th birthday, the month of your 65th birthday, and then 3 months after. And then you have AEP, which everybody, you know, always kind of looks around, and that's between October 15th and December 7th, right? When all the plans come out with their new plans that would go into effect for January 1st of the following year. You know, definitely recommend that you know, kind of look and you compare, you know, because every company offers different plans, right? You know, some drop things, some don't. Like, you know, Univera, we got that robust network, you know, we strive off of that great network that we have. And then you have an SEP, which is that special election period, right? So there are a few that are still going on because of COVID that you'd be able to use in order to switch your plan. There's EPIC. That's considered to be a special election if you recently moved into the area. And then, of course, a 5-star HMO plan like Univera is. You know, that's the highest rating that you can get from Medicare. And that's from all the feedback, right? All that great feedback that we get from our providers and from our members, right? And using that 5-star election, that could get you switched over at any time you want by using that election.
And that's important. If you make a decision and now all of a sudden you're second guessing it and you think, oh, you know what, I think this plan is better for me. That's why you folks are here, is that you can help make that happen. And also we should let people know, we understand that your health changes. Something may come up from one year to the next. And that's, for example, let's talk about the Part D prescription coverage. All of a sudden I need a new drug. How do I know if my drug is covered?
Yeah, just to go back one more on that election, just to kind of piggyback off of that, Linda, a little bit. So you also have that that OEP, which is that open election period, right? And that goes on from, you know, January 1st all the way to March 31st. And that kind of gives you your one more chance to kind of review, right? The plan that you recently just switched to, or the current plan that you have, right? So the great thing is to make sure that you really never are locked into just one plan, especially with all those special elections, that 5-star that we have. Yeah, you know, and prescriptions. When somebody comes in to see me, one-on-one consultation, love it. They can come right into 205 Park Club Lane. I'm here all the time. I love those one-on-ones. And when you get to a little bit of background, you know, you get their health background, and then you ask them about their prescriptions. I encourage them to bring a list of their prescriptions. We go over a formulary. I explain to them what tiers that their prescriptions possibly fall on, right? It could be tier 1, which is your generics. It kind of gives them just a better understanding on how much they would be paying for their prescriptions going forward.
Yes, and you know, it's interesting too, because when you think of your life, and as we say, everybody is different. Let's say you're a snowbird. Well, that might mean, you know, you have to let someone like you know that, Michelle, because that might make a difference in the plan that you pick. So since everybody is different, it's also great to bring another person with you. You know, if you have a son or a daughter who's interested in your health, 4 years are better than 2. There's always questions, and people are always welcome to come in and sit through those appointments.
Absolutely. And you know what? They sometimes know them, you know, your child knows you better than you know yourself, right?
Exactly.
Yeah. So.
Exactly. That's so true. Hey, Larry, let me ask you, we talked a little bit about the Part D coverage, and for some people, as Bill was saying, who don't necessarily need to sign up for that. But Larry, for someone who is new to Medicare and living in Western New York, why might they choose a Medicare Advantage plan? Or when would somebody new to Medicare and living in Western New York choose a Medicare Advantage plan?
You know, I think if you're talking about the choices of the Medicare Advantage programs that are available, or what would be the criteria for somebody to choose a Medicare Advantage program, it's a difficult question, only because of the fact that each individual situation is different. Okay. As you guys had said, their current health conditions, the current physicians they're using, their marital status, do they have dependent children? I mean, but I think what the question that you're asking is which is probably, you know, if someone would be new to Medicare plan, why would they take a Medicare Advantage program? If that's the general question. The general question to that is usually going to be dictated by cost, the cost of the programs, okay? If the cost was not an issue, to be all honest with you, everybody would choose a Medicare supplement policy. Why not? No co-insurance for the hospital, no in-hospital situations. So the cost is usually the driving factor for most people initially. Coverage is certainly important as well. But most people now who are reaching 65 years old, who are coming off of some sort of a health plan, generally have deductibles that can range anywhere from $4,000 to $7,000, pretty standard across the board for healthcare. So what most people need to understand is when choosing between their current group health plan, whether they're retiring or not, and whether or not they're going on Medicare, is both the cost and the overall coverage. Medicare by itself, without any plan, generally is more comprehensive than most of the group health programs that are available today, with the exception of prescription drugs. But the primary coverage that people are looking for, you know, the type of expenses that would really hurt somebody financially, the long-term care, the hospitalization, the medical care, those type of things. You know, those are the questions that you would have to ask yourself. But if you wanted to know, if I was turning 65 today, I'm 10 years out from that, but if I was turning 65 today, it would be unlikely for me not to take a Medicare Advantage program. I'm paying $1,200 a month for my hospitalization insurance right now. Okay. It is through a group, but I have to pay for it myself. I get Medicare for $170 a month and it pays 80% of my bills. It's a very, very, very good value.
Right.
There's very few health plans that would cover you as comprehensively as Medicare would. And let's also take into consideration that Medicare is a private fee-for-service plan, which means it has less restrictions than most other plans do as well. So it's an extremely good value. As far as the Medicare Advantage or the type of a Medicare Advantage program, that is an interesting question. One of the things I've noticed in my 30 plus years of working with, obviously Medicare Advantage didn't become available to 2006, but prior to that, all we had was Medicare Supplement. Okay. So I have a very good perspective on both sides of it. The local plans that are offered here right now, Independent Health, Blue Cross Blue Shield, and Univera, are all 5-star programs. Now, I do want to talk about that for a second because it is very, very important. Because unlike a lot of other ratings, one of the biggest components in the 5-star rating that Univera has, Blue Cross has, and Independent Health has is customer satisfaction.
Yes.
That is the biggest factor in the 5-star rating system. Most rating systems are not really designed like that. How good is the company? How solid is the company? How are they doing financially? Those are all good things. But really, customer satisfaction is what most people are interested in. The relationship that these carriers have, that these local carriers have with your doctors is huge, because in many cases, they have to work together to deal with whatever you've got in front of you. I'm not saying that none of the national carriers can do that, but it's sort of second nature to the local programs. Like, I've been doing it for 35 years. These local carriers have been here that whole 35 years. And that 35 years, they've been working with all the doctors. They've been working with all the hospitals. They've been working with all the nursing homes. So they do have a very customer-friendly situation. And ultimately, they tend to be able to smooth out all the bumps that come with that type of healthcare without involving the actual patient who is already dealing with the fact that they're sick.
Yeah.
So
Right.
that's why I tend to use those programs. It's not that the national carriers are bad, and sometimes the national carriers, for certain individuals, like I said, especially if somebody wants a PPO where they can go to Florida, they're a snowbird. National carriers work very well for that, because often that PPO is going to be recognized just as well in Naples at Florida as it is here in Buffalo, New York. And if you want a seamless transition between your winter and summer residents, those type of programs have their place as well.
Right.
Also, sometimes they'll be just by the nature of that. Do you want to catch one thing you mentioned briefly about a lot of the telesales that are going on, or the television stuff right now? People need to understand that that's not a carrier doing that.
Right.
That is not an insurance carrier putting out those commercials. That is essentially an insurance agency that works for probably 10 or 15 different insurance companies. And ultimately, it's just not a great situation, especially for somebody that's just turning 65, or somebody that's confused on what type of program they could go with. Because ultimately, yes.
I was going to say, plus Larry and Michelle and Bill, you see this all the time. And Michelle, if I say, look, I want to make sure I can stay with ECMC, or I want to make sure my doctor is covered, and he works, let's say, at Miller Fillmore Suburban, you know what I'm talking about. If I'm calling some 800 number, they don't know Roswell. They don't know. They just don't know who our doctors are here and who our service providers are here.
Absolutely, too. And it's a really good point too, Linda, is just being a local company. Right. Being a local company, you know what hospitals, as we, 100% of the hospitals, our providers, our provider network is very, like I said, amazing, robust network that we also have. So yeah, just those nonprofit companies, right? Customer services are local. So those are like the key points that, it's a peace of mind for the older generation, for the
Absolutely.
older population.
The person who helps with your Medicare becomes just as important as your pharmacist, your doctor. It's that person who really understands your plan. And with one phone call, you can put my mind to rest about what I'm covered for. And no, Linda, maybe we have to change that plan. Bill, you see people all the time. What's your best advice for someone who's new to Medicare? What red flags should they watch out for when researching or shopping for plans?
Well, you have to look out for the limitations in the coverage. That's one thing you want to look out for. I never recommend someone just to have Medicare alone because there's no cap, like mentioned earlier, to the out-of-pocket expenses. For example, if you have dialysis, a lot of your Medicare Advantage have a 20% co-insurance. That could be very expensive. Right. If you have infusion meds, a lot of times that's a 20% co-insurance. Well, as Larry mentioned before, your supplemental policies could pick up those co-insurances for Medicare Part B. At least most of them will. And that gets very expensive for people. The network's a big issue, especially if it's an HMO. Those are big red flags. The network for hospitals, as talked about before. In my experience, local can do a very good job, but there's some national ones that can do a very good job as well. I've got to be unbiased by law. Okay, I do not sell insurance, so I can't recommend one over the other. I'll get people that buy supplemental policies from the very start because it makes sense for them, or they're planning for future needs.
Right.
So it depends. Like the others have mentioned, it's not one fits all. I've been doing this since 1984. I know a lot of history about it and the changes. The Medicare Advantage started 26 years ago. The predecessor to Univera was the first one in town. It was $40 a month. 2006, they greatly improved when Medicare Part D came into existence. And this is why
we do seminars like this or webinars, because it's a daunting subject, but we have such great experts where you do not have to go it alone for Medicare. By the time you walk in and after an appointment with Michelle or with Larry or even sitting down with Bill, you're going to be sure about what you're getting. You're going to have all your questions answered, and you're going to be very confident about the medical plan that's right for you and your wallet, as well. I want to get to some of the pre-submitted questions. And here's one. I have health coverage through my employer at a minimal cost, and my husband has the same coverage through his employer, the city of Buffalo, at no cost in our retirement. He was injured on the job and now has Medicare B. We didn't know he had to take it within a certain time, and now it is somewhat reduced. Will I have to take Medicare B by a certain age, and will I still be able to keep my current healthcare coverage? Ooh, who wants to handle that one?
Depends.
I can hear.
Okay,
Larry,
Larry,
go for it.
Yeah, I'll take it.
It depends.
Go ahead, Michelle.
Go ahead, Larry. You got this one. That was your part of your question, remember?
Yes, it was part of my question. Just so I can keep the question, ask it one more time, Linda, just so I can answer it properly.
Okay, this person has health coverage through their employer at a minimal cost. Husband has the same coverage through his employer at no cost. Okay. He was injured on the job, now has Medicare B. We didn't know he had to take it within a certain time, and now it is somewhat reduced. Will I too have to take? Go ahead.
I think what he probably meant was he was paying some additional costs for Part B.
Right.
And that was because he did not enroll during his enrollment period, that 7-month period that they had talked about earlier. And if you don't do that, they start to penalize you for every month, literally, that you did not enroll in the Part B of Medicare. Her situation, although I could see where she would get confused because she had employer coverage, okay, through her current employer. There's also, again, I probably have to dig in this a little bit more because of the disability situation, because that could have an effect on his enrollment as well, as far as which plan that he would have. But I have worked with a lot of people that retired from the county and a lot of people that retired from the city of Buffalo. So just based on that, ultimately speaking, those people are required to take their Part B of Medicare when they reach the age of 65 years old, assuming that they're not still working. Bill's a perfect example of that. He's continued to work after 65. Therefore, he is still eligible for his group health program, does not have to take Part B of Medicare, and will not be penalized because he is still gainfully employed, working a minimum, I think the Medicare rule is 25 hours a week. So that would be the determining factor. Now, why the benefit itself would not be reduced, but his cost for Part B of Medicare would be increased.
It sounds to me that if this person had one of you on speed dial, they wouldn't have had that problem, because you've warned them about that. And that's your job, is to let people know, what they're going to be coming up and what's going to be better for them for Medicare, so they don't miss deadlines and things like that. All right, Michelle, here's one. This person says, I'm receiving SS benefits as of May 2022. However, I will be 65 in January 2023. Will SS automatically sign me up for Medicare A and B? I'm aware this does happen. I just want to make sure, because otherwise I will have to sign up for Medicare. Thank you.
You know what? Because of COVID, there are so many crazy situations that have gone on. And I was always told, don't ever assume, right? But I mean, they're on Social Security since May, right? That you said, and they're not turning 65 until January, did you say?
Right, another year, yep.
Yeah, so most likely, I mean, they don't, have to pay, have to call them, because they show already they're on disability, right? I said, so they should be already on Medicare, right? They should already have that Part A and that Part B. So, it doesn't hurt though to just just get a hold of one of us. There's Bill, there's myself, and there's also Larry, right? There's Medicare experts. Please don't call that 1-800 number and talk to Joe Namath or JJ Walker. No.
Yeah, good luck with that anyway, right?
Also just a phone call away to Social Security too. It might take you a little bit to get through, but they'll always answer, your questions that you have as well.
You know what? And that's good, because let me go to Bill for this one. Bill, here's another question that was pre-submitted. This person is currently managing a serious health condition with several tier 3 prescriptions. As we know, prescriptions get put on different levels depending how expensive they are. This person's cost is only the copay through their spouse's employer health plan. What can I expect my out-of-pocket expense to be when I change to Medicare?
When you change to Medicare, assuming you can't get something from your previous employer, you would have to look and see at that time. Also realize if the person has a Medicare Part D, and if they're over age 65, they can get that elderly pharmaceutical insurance coverage.
Right.
65 income under 75,000 for an individual, 100,000 for a couple. Or they might be able to qualify for the low income subsidy or the Medicare Savings program. Yes. The Medicare Savings program has no asset cap in New York State. So there is an net income cap of $1,549 a month for an individual. And Larry mentioned before the higher cost for the supplemental policies. What you pay for a supplemental could come off your gross income to possibly help you qualify for the Medicare Savings program. They'll pay the $170 for you, and you automatically get extra help, regardless how much assets you have. So when they call us, at least we review all the government programs for them. I'm a government employee paid for from a grant from the Administration on Community Living. So I have to be advised.
Bill, what I'm hearing from you is that there's an awful lot of information and plans to help people that we, as the lay people, would not even know about. You don't even know that these things are available. But the important thing is that you do, Michelle does, Larry does. And when you go in and you sit down, give these folks an hour or so, show them exactly what your needs will be. And they're going to do their best to get you a plan that fits your needs. And don't be surprised, again, if it's a plan that's different from your spouse or different from your best friend. These plans are all unique.
Linda, another thing too is that what I found out as well is that, again, COVID, right? Something that we just, finally it's in the past, but a lot of the manufacturers are stepping up and helping with a lot of the prescription drugs for those people who are on those tier 3s and tier 4s. So, again, they could always just reach out to those manufacturers, and a lot of those manufacturers have a patient assistance program. And it's an 800 number, it's a form they fill out, and there's a very good chance that they would be able to get that very expensive prescription at a lower affordable cost.
Yeah, that's good to know. And again, a lot of people worry about that.
Yeah.
But
We have
unless,
a directory.
exactly,
At the county
yeah.
of Erie. We have a directory of all the patient assistance programs.
Yes.
Yeah.
And I understand that if, let's say, someone is diabetic, now all of a sudden there's new information about insulin coming out that could save people a lot of money. If they're checking in with you folks, and they should check in, even if they've worked with you once a year, you may not need to change anything, but it's important, Michelle, because my health may have changed in that year. And it's great to sit down and just go over the plan again, because there still may be something better out there that you can turn them on to.
Yeah, that's the annual enrollment period, right? There we just already discussed that. October 15th through December 7th. That's the time where you start comparing and to see whatever plan works best for you. You get those nice grids like Bill was explaining. He has those grids and he does the comparison, and it's just very important to check, because your health can change, and what the companies have to offer every year also changes.
Hey, Michelle, let me ask you this. Go, please, Larry, jump right in.
I just wanted to talk to one other aspect of that question to answer it fully for that individual. Okay. When you're under 65 and you're on a group health program, there's not as much premium on the difference between brand names and generic medications. So therefore, the physicians tend to, it doesn't really matter. Because there's not usually that big of a difference in cost, maybe a $5 copay or a $20 copay. So there's no top end benefit problems. But generally speaking, one of the things that happens is when you have some incentive to look at your medications by going on Medicare, because now there is going to be a significant difference. There's going to be a cap on the coverage and stuff like that. At that particular point in time, too, you may want to have, with you and your physician, review some of those medications to see whether or not there are some alternatives to those type of medications. Again, under 65 on a group health plan, not a lot of incentives. The doctors will pretty much prescribe whatever they would like to prescribe. But a lot of times if you just talk with your physician and say, listen, I'm taking XYZ drugs, they're all brand names. Is there any generic equivalents for these particular medications? That is the question. But overall, generally Part D of Medicare, if you compare it to a group health plan, there are going to be some additional costs for somebody reaching 65 years old if they're in a severe medication problem situation where, let's say, their drugs were over $10,000 a year. So they do need to be aware of that. As Bill had said and Michelle had said, there are a lot of government programs available for those type of situations. But again, there's also some proactive things that beneficiary can do to reduce some of those costs as well.
Absolutely.
Yes.
Hey, I'm going to give everybody the information to approach you folks. They're going to be looking for your phone numbers and websites, and I'm going to do that at the end. But right now, Bill, you are holding up some information. People would like to know how to get that.
They call us at 716-858-7883. Again,
Okay.
716-858-7883. We've got here the steps. We have the information about the Medicare Savings Program, the low-income subsidy, information about pooled trust for people that are disabled to help them get Medicaid at a higher income limit or resource limit. Chock full of information here. Paid for by your tax dollars.
Hey, Michelle, why don't you give us your number and the best way and time to get you?
Yeah, absolutely. My phone number is 716-572-8315. And of course, it's my first, michelle.richin@univerahealthcare.com.
Fantastic. And Larry?
Larry Acker, of course, we're at 664 Niagara Falls Boulevard. You can come in anytime at our office. You don't need an appointment. You can walk in the door. But my phone number is 716-693-6800. And our email is office@srhlth.com.
Yeah, and I guarantee anybody who's really confused about Medicare and you see this deadline coming up, you're going to feel so much better after a conversation with one of these experts. You know, I brought up briefly diabetes. I'm going to go back to Michelle. Michelle, what would you say right now is the best Medicare coverage for someone who's diabetic?
Well, there's plans, so we do have an insulin savings program, that are part of our plans. And not all plans have those, but you can get insulin for a 30-day supply for either $30 a month or $25 for a 30-day supply. So yeah, again, that's just coming to 205 Park Club Lane, sitting down with me, doing a little bit of listening, and just getting a background of their health. And if they are a diabetic, you kind of go through all those diabetic supplies, right? The test strips and, the free meters that we offer. But yes, insulin is now a lot affordable than it was before.
Absolutely.
It's very affordable now, thank God, because it was very expensive. But yes, some of our plans do include that.
Yeah, the tier 6.
Yes.
Or tier 6 med.
We're getting a lot of good questions over in the chat, so I'm going to put this out there to you folks, and maybe you can put your heads together on this one. Someone says, I am 66, will stop working, and will not be claiming SS at this time, but I will need to obtain health insurance. I did register for Part A at 65. I'm now listening, and I'm worried that I will be penalized. I did prove coverage at 65. Somewhat confusing, as the insurer advised me that this was all I needed to do at 65.
Are they covered by active employment, either their own or their spouses?
I would assume so, because they're 66. They will stop working, so they're still working. So most likely, yes.
If it is, you've got 8 months to pick up Part B without penalty. You want to find ways to fill in the gaps in Medicare. Like you said, we've got our directory. Larry knows resources as well.
Yeah, we have a special, we actually have the form. Medicare uses a special form that has to be filled out by the employer, okay? So there's a part for the beneficiary to fill out for the Part B. Basically what they've got to do is a special election for Part B of Medicare, okay?
Right.
There's a form for that one part has to be filled out by the prior employer and one part has to be filled out by the beneficiary. We do assist people with filling out those forms. We have them here. We submit all that in, and the bottom line is, though, he will not be penalized for Part B, for applying for Part B of Medicare after he turns 65, again, because he met the requirements of continuing to work past 65 years old. He was continuously covered under his group health program, and therefore he should not be penalized. However, have I seen people in his situation get penalized? Yes. And it's because they did not take care of the paperwork that was required to void them from the penalty. So,
or
they wait too long.
Or they wait too long. Yeah.
And to, just to piggyback too off of that, if they're an employer group, if they go to their HR department, I'm sure, a lot of those HRs have a lot of those forms that they also need. So they could always, reach out to the Human Resources Department.
And I do want to also let people know that I think that seeing any of you folks is absolutely complimentary to the person who's coming in for the information.
Right. I have 4 volunteers in Erie County as well. At Amherst and Tonawanda and Hamburg that are pledged to be unbiased.
Right.
We don't have anything, and I talk real straight with people. I'm not pushing any products. I'm looking for the best coverage available. And I'm paid by your tax dollars.
There you go.
You're saying that a lot, Bill.
Yeah, well, I have to.
Too, Linda, of course, 205 Park Club Lane is where we are. Also, I go to all of the senior centers. You know, every month I go to, you know, every different county that's available. I visit the senior centers. If they can't get here and they're closer to a senior center, you can always make an appointment too. And I'd be more than happy to do a one-on-one there as well.
Absolutely. Even if you won't be 65 for another year,
Right.
it's so
Any
important to come
questions?
in, and get a basic understanding of how this works, whether you're married, whether you're single, whether you're a veteran, whether you travel. What are your plans, you know, about living in Western New York? Because these folks really have a plethora of information for you that's only going to help you down the road, because you're going to have your answers and you're going to feel confident knowing you're going to have that coverage. Larry, I bet that you get a lot of people who come in with a lot of misinformation that you're happy to change for them.
Yeah, I mean, right. This year especially, we've been getting a lot of people that have been how do I put it nicely, have been put in programs that weren't really appropriate for them.
Oh.
So we've had to do a lot of corrections for people this year, because they've got involved with one of those telephone things. They applied for a program. They found out that it really wasn't appropriate for their situation. And again, the other thing is, we did get an extension on the special election period to the end of June this year because of gun violence and COVID. So actually right now, if someone's unhappy with their program today, they have till the end of this month to make a special election, which is outside of the normal special elections, which is for the gun violence and for the COVID, for the FEMA. So if you got into one of those situations and you're clearly unhappy with your particular program, understand at least until this end of this month, you're guaranteed to be able to change to something different if you're not happy.
That's great. That's great to know.
Yeah.
So I'm not stuck with JJ or Joe.
No.
I don't think it's Joe or JJ's fault, actually. I like
No.
Joe Davis.
Right.
But he's doing the commercial for the organization.
Right.
But and by the way, isn't he covered by the NFL?
I guess he is, as a matter of fact. But you know, it's interesting. I'm hoping that they get the least amount of calls from Western New York, because we're smart enough to go to someone local who knows better and can give them everything that they need.
Yeah, one of the big hooks now is that cash back on the Part B.
Yes.
Okay,
Right.
I just want to warn everybody that is sometimes appropriate, but not all the time. And there is a trade-off for getting that $75 or $50 or $30 back on your Social Security. So you should be fully aware of what those trade-offs are before going into one of those cashback programs, because there are some significant things that could hurt you that you may not be aware of.
Yeah, you gotta watch the co-pays and deductibles.
The co-pays, yes.
And also the drug plans.
Right.
The drug plans on those programs often have larger deductibles and larger copays. That if somebody's taking 4 or 5 medications, that $30, $40 a month or $70 a month that they're putting back in their Social Security could be easily wiped out by those additional copays. So be very careful if you are on one of those plans, or if you're looking into one of those plans. And again, we can do that for you as well. We have those plans. It's not like we don't have them. We have them. It's just, we maybe use them for like 5% of the beneficiaries that we have. So, but if you listen to the commercials, you'd think that everybody was going with those type of programs, and that's just not the case.
Yes, they make it seem like they're offering something I don't have. And that's the point of those commercials. But
well, and the other thing is, let's also remember, they're literally explaining 5 different plans and making it look like it's one plan.
Exactly.
Those benefits are not, none of those benefits they're explaining are all in one plan.
Yes.
Right.
So that's what another thing that people need to understand.
You got to get a comparison sheet, compare line by line.
Yes.
Yes.
And the formulary for the meds and the drugstore.
I would agree with Bill. The formulary is huge.
Yes.
And that is what lets you know what drugs are in your plan, is that formulary. That's the word for that.
Correct.
So that's why it's important when I come to see you, Michelle or Larry or Bill, I bring that list of prescriptions with me.
Yes.
So I can compare what's going to be covered, maybe the generic, but I'll find out for sure. And it's 8 o'clock. Go ahead. I was going to say, Larry, last words.
Thank you, everyone, for coming.
You,
anyone who would like to talk to me, I'm at 664 Niagara Falls Boulevard. Have a great day.
All right. And with that, let me give the phone numbers again, because I promised I would. First of all, folks, if you have any questions, and we've really got you thinking now about your Medicare, please call 716-572-8888. 8315 or visit www.univeraformedicare.com. You're going to get great people like Michelle working on your side. You're going to be so happy. That's univeraformedicare.com. Once again, Larry's number, 716-693-6800. And for Bill, 716-858-4807. And folks, if you came in late or missed part of this, remember, this has been recorded, and in its entirety, it can be sent out to all our registrants. Okay. In fact, it will be. So you'll get the entire hour. Thanks, everybody. Thanks, Univera.
you.
Thanks to the Buffalo
Welcome.
News. You folks did a great job. And hopefully we've got more people enlightened about their Medicare choices. And with that, everybody, it's great to see you again.
You
Have
too.
a great night. Have a great
Thanks for
summer.
the invite.
You
Have a
too,
good
Linda.
night.
Thank you.
Bye-bye, everybody.
Bye.